In this lesson, we will discuss becoming a physical activity professional. We will acquaint you with what it means to be a professional, and more specifically, a physical activity professional, explain the types of knowledge and skills essential for performing professional work, discuss what you need to do during your undergraduate years in order to gain entry into and succeed in your chosen professional field, and help you to determine whether you are suited for a career in physical activity. What career will you pursue? The purpose of this chapter is to help you explore your options, help you make decisions about what profession might suit you best, and help prepare you to become a physical activity professional. It's important to note that your profession may change several times in your career, and this is nothing to worry about. Some skills you will learn within your career carry over into different careers, and your needs and priorities change during different stages of life. In the coming chapters, we will look at different fields for practice in physical activity professions. Chapter 12, we look at health and fitness. Chapter 13, therapeutic exercise. Chapter 14, teaching physical education. Chapter 15, coaching and sport instruction. And Chapter 16, sport management. Looking at the characteristics of professionals, they are able to master complex skills, which are grounded and guided by systematic theory and research, possess cognitive, perceptual, and interpersonal skills. They perform services for others, such as clients or patients, are granted a monopoly by the community to supply certain services. They are guided by ethical codes, formal and informal, that preserve health and the well-being of clients, and meet expectations and standards prescribed by the professional subcultures. Looking at this figure, we have professionals on the left side of the continuum that perform all the skills and expectations from side 5. On the right side, expectations would be more on the manual or automatic labor side. It's important that you know what a profession is, what type of work professionals do, how to gain entry and acceptance in a profession, the obligations of professionals, and the important factors to consider in preparing for a career in physical activity and professions. Many of these questions you will answer in your professional career research assignment and interview. Professionals have mastered complex skills grounded in theory. They draw on a complex body of knowledge and theory that is developed through systematic research. They are gifted thinkers and also gifted doers or practitioners, able to bring about predetermined outcomes efficiently and effectively, usually on the behalf of others. For example, a physical therapist helping a patient regain strength through specific exercises after surgery. They are skilled experts with the cognitive, perceptual, and interpersonal skills needed to succeed in their profession. Several different types of knowledge go into acquiring professional expertise, including theoretical kinesiology knowledge. So that would be the knowledge you gain from books and classes about the basis of subdisciplines. Physical activity experience are the things that you've done that compile your experience. For example, if you were a soccer player, that helps you become a soccer coach. Professional practice knowledge is the things you learn while working or in an internship, perhaps how one rehabilitation tool works better than another. Workplace knowledge is the knowledge you gain while on the job as well, but more specific to the job. Things like how to operate an insurance billing software if you're an occupational therapist, or how to use a specific key card to open a door. Looking at how values shape our professional conduct. We have two kind of ends of the spectrum. Mechanical market-driven professionalism is practitioners who value the profession, profit, personal prestige, and status over the rights and needs of their client. So an example of this might be Michael Jackson's plastic surgeon who operated on his nose one too many times. That surgeon had to have known that his bone structure couldn't hold up any more surgery, but went ahead and did the surgery anyway, probably because the high visibility of the surgery, hoping for good results. On the other end of the spectrum, we have social trustee or civic professionalism. These practitioners value clients and social good more than themselves or the profession. So an example here might be trying to treat too many patients in a day because you have that many patients, but it causes too much stress on you, the practitioner, so that you're, physically tired or something like that. So ideally, you want to be somewhere in the middle of this spectrum. The personal values you bring to your work will determine your goals and method of operation as a professional. Read the sidebar in your textbook titled, "How does your personality match up with your career? Which personality best describes you? What careers in kinesiology sound most interesting to you? Is it a match with your personality selection?" Looking at how physical activity professionals are educated for the workforce, your coursework comes from liberal arts and sciences like history and anatomy, and coursework in physical activity knowledge like health psychology, creating a wellness lifestyle, and coursework in theoretical kinesiology like your biomechanics and exercise physiology classes. Coursework in professional practice knowledge comes from your later classes like research and internship. You can see that your liberal arts classes are the root of this tree, needing to hold up and prepare a foundation for your kinesiology class knowledge. Some questions you should be asking yourself is if you are suited for a career in physical activity. Do your attitudes, values, and goals match with those of professionals? Are you really interested in physical activity? Do your attitudes, interests, and talents lend themselves to specific physical activity profession? And will your college or university program prepare you well? I'd like to say yes there. If your answer to any of these questions becomes no, you shouldn't be afraid to make a career or study change. You should also ask yourself, how committed are you to preparing to be the best professional possible? You should be providing excellence in your academic work, getting good grades, and showing true interest in subject matter, showing an early identification in the professional field, knowing that this is the field for you, engaging in college and university life, participating in associations like the Pre-Therapy Student Association or joining state and national associations, and participating in volunteer services, volunteering at clinics, or getting observation hours, and attending graduate school.